For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good morning, everybody. My name is Ricardo Romero Morales. I'm a lead public information officer with the County of Santa Clara. Thank you for being here this morning. Today we're going to provide an update regarding the new variant here in Santa Clara County. And today we're honored to have Dr. Sarah Cody, Health Officer of Santa Clara County, as well as Dr. Marty Fensterscheib, who is our Health Officer for vaccinations and testing here in Santa Clara County. We will begin in English and we will take questions and answers in English as well. After that, we'll move into Spanish, Chinese, and Vietnamese. Without any further ado, I welcome Dr. Sarah Cody.
Good morning, everyone. Good to be here on a crisp December morning. So I want to share with you updates regarding Omicron here in Santa Clara County. Have two related updates, and then I'm going to turn it over to Dr. Fensterscheib to talk a little bit more about vaccination and boosting. So yesterday, we received our first report of a resident of Santa Clara County with the Omicron variant. This person was fully vaccinated, but not yet boosted. They first had some symptoms on November 30th, got tested on December 1st, and we received the sequencing results yesterday that confirmed that they have the Omicron variant. They had very mild symptoms, which resolved quickly, and they have been isolating at home. This was the person with the Omicron variant had traveled to Florida, most likely where they were exposed, so a community exposure in Florida rather than an international exposure, and then, of course, came back here, so an imported case, but a domestic imported case. So ever since we first learned about Omicron, we have been anticipating a detection here because our population is large and our population is diverse and our population is mobile. And we have two different ways that we've been looking for to detect Omicron. One, of course, is through isolates from people, as in this case that I just described. And the other is a surveillance system that we have in our sewer sheds. So 4 different sewer sheds in the county. We have samples collected every day and tested. And so that's both to detect the SARS-CoV-2 virus as well as the variants that are emerging. So yesterday, we also received results of the first Omicron detection in a sewer shed in our county. So we have 4 sewer sheds where we do this surveillance. The sewer shed with the detection was the sewer shed that serves North County. It's about a little over 200,000 population under surveillance and serves Palo Alto, Mountain View, Los Altos Hills, Stanford, and a little sliver of San Mateo County. So that sewer shed, samples taken on December 7th, we received the results yesterday that there's an Omicron detection there. The resident of our county with the Omicron lives in the catchment area of that sewer shed. So this is interesting and important because it tells us that these surveillance systems are both giving us the same information. So the question is, what does this change? Do we do anything differently now that we have this information? I would point to some other information that we have on our dashboard where you can see quite clearly that the rates among unvaccinated are going straight up. They are now above 80 cases per 100,000 population per day. They are also increasing among the vaccinated, although much less dramatically, much more gradually, and much more slowly. But they are rising a bit nevertheless, which underscores the importance of boosting. So in addition to vaccination and boosting, which Dr. Fensterscheib will talk about in just a moment, I also want to underscore the 4 other incredibly important prevention layers that we've been talking about for almost 2 years that are still important, and I think that we need to rededicate ourselves to these practices. They are testing, masking, particularly when indoors or in a crowded outdoor setting, ventilation, outdoors as we are now, much better ventilation than indoors, and distancing. And by distancing, I mean both the distance that we keep between people as well as the size of gatherings and just the general number of people that each of us are in contact with every day. So vaccinate and boost, mask, test, ventilate, and distance. With that, I will turn it over to Dr. Fensterscheib, and then we'll both be available for questions.
Thank you, Dr. Cody. Good afternoon, everyone. So, yes, we now have Omicron in our county, and that was to be expected. How have we done with our vaccinations? Well, if you notice on our dashboards, we are approaching 80% of all of our population being fully vaccinated, and that's quite amazing. We have some of the highest vaccination rates in the United States. However, what we're finding now is that having just that primary series, the 2 doses, it's not enough. It's just not enough. And we need to now move to make sure that everyone that is eligible gets boosted. So how are we doing on our boosters? Well, basically, we have about 39% of our eligible population that has come in to get their booster. 39%, again, pretty low. And it's even lower in the 18 to 49-year-olds, which is only 20%. So if you're over 50 or over 65, you've done better. You've come in to get your booster at a higher rate. But the young members of our community who are now eligible for a booster have not yet come in, only 20%. So we're concerned about that. We're doing very well with the 5 to 11 age group, and nearly 40% of the 5 to 11s have had at least 1 dose of vaccine. So that's wonderful. And again, we urge parents to get their young children vaccinated, either through one of the existing school-based clinics or when they go on break. We really want you to take the opportunity to get your child vaccinated during the break. So I think at this point, we really want to make sure that we enforce all of that information and that people, again, pay attention. I also want to make mention in the 5 to 11 group that we still have some disparities, and we look at the numbers that the vaccination rates of children who live on East Side and in the South County are in some cases half of what they are in other areas of the community, again, which represents the Latino population and the African American population, again, that have not received the vaccinations at the rate that other members of their community. So again, as Dr. Cody said, our message moving forward for the holiday especially is get vaccinated. If you're eligible, get boosted. And if you have a child between 5 and 11 that hasn't been vaccinated yet, get them vaccinated. And then one more plug, because it's now December and we're coming into flu season. We know there will be a flu season this year. Last year at this time we were pretty flat, but there have been some cases, not many yet. But again, this is the time to get a flu shot. So 6 months and older, you're eligible for a flu vaccine. Please get that, and you can get it at the same time as you get your booster. And I'll end there.
We'll now start taking questions. We'll call on everyone individually if you can identify your outlet and which doctor your question is for. And we will start over here with KCBS.
For Dr. Fensterscheib, so you mentioned that in East San Jose, children aren't as vaccinated as other communities. Why do you think that is? Because you guys have really made an effort to have the vaccines available out the school grounds and drop-in sites and things like that. So what's the issue?
Well, the issue is it hasn't been that long since we had those children eligible, but again, we are not getting them vaccinated at the same rate as many of the other children in the community. We want to urge parents, again, that the vaccine is safe, and to overcome some of that hesitancy or concern that they may have in getting their children vaccinated.
You don't think it's an access issue or anything like
Is it an access issue? We're working very hard with the school, with the County Office of Education to get our clinics at the schools, and we have a number of large sites in the community also. So I don't think it's as much an access issue as it is to getting the message out and really urging the community to come on down. There's plenty of vaccine to get their kids vaccinated.
Are there any other close contacts at this point, or anything else to report as far as the first person that has Omicron? Are they now at home, or how is that working for them?
Our first Omicron case began isolating after symptom development. The close contacts that the case knew about have been reached and contacted. I want to say that what we know about the Omicron variant is that it spreads quickly, perhaps more quickly than the Delta variant. So the time is going to come very soon where we're not going to be able to do detailed contact investigations for every case. Mm-hmm. So this is a question around case rates and how we've used case rates and future policy, and particularly with regards to announcements by Marin County recently. The context in Marin County is a little bit different because they already met the metrics to stand down with their indoor mask mandate. So this isn't a conversation of talking about what metrics would they need to think about as far as indicating a need to return to indoor masking. So different than what we're talking about here. In general, what I would say about case rates is that they are one surveillance system to give us a sense for the cadence and the pace of the pandemic. But as we transition to more tests, which are not reportable to us, it becomes even more important to have other systems to look at. And so we have a couple ways to do that. One of them is the wastewater surveillance that I mentioned earlier and that also detected the Omicron. There's also some kind of general symptom surveillance that can give us a sense. And then, of course, to measure how severe is this, we look at hospitalizations. One caveat to the hospitalization data is that it's a lagging indicator. So you'd see a bump in cases, and then a few weeks later, you see a bump in hospitalizations. So really good for helping us understand the impact on the healthcare system, but not an early warning system. Thanks.
How severe are this patient's symptoms, and what impact did the fact that he's fully vaccinated have or did not have, and how we have a booster shot that helps with symptoms or diagnosis?
Well, if Dr. Cody wants to talk about the case, but I think the case for the importance of getting a booster is very clear, and it's getting even clearer. And I was looking at some Israeli data this morning to show that clearly the 2-dose series is just not enough at this point. But yet when they looked at, and they have data already on cases and those that were boosted, and it's much lower. So we really want to urge people that they need the booster. It's now we want to consider it part of that primary series, and we really need to add that on as a necessity. It's not yet required. There's no definition change in completely vaccinated, but let's just think of it as if you're 6 months out from your primary series, you just go ahead and get your booster.
Yeah, maybe you can emphasize on the difference that maybe the booster might or might not have and any impact that fully vaccinated.
So our case with Omicron was fully vaccinated, but not yet boosted. A booster, and as Dr. Fensterscheid mentioned, we know that immunity wanes with the primary series, and that is why the booster is every day we learn how important it is, more and more important. And so I would say with full conviction that every single person who is eligible for a booster, that means you're age 16 or older, should get a booster. It lessens the chance that you will become infected and infectious. Doesn't eliminate it, but it reduces it, and it drastically reduces the risk of hospitalization or death. Our case of Omicron had been vaccinated but not boosted. They had a very mild illness.
Was that person due for a booster and didn't get it, or was the person just not boosted because they were vaccinated?
They were just becoming due for a booster, and I believe had plans to be boosted this month.
Yeah, are there demographic details as to what this case was, such as man or woman, or are there any underlying conditions that this person might have had?
What's important to know about this case is that they are an adult. They are a resident of Santa Clara County. They were fully vaccinated but not boosted, and their illness was mild. They are the first report. I am confident they are not the first case or the only case, and I anticipate that we will hear of many more Omicron detections in the very near future.
Take a few more questions back from Mercury News.
We know that a lot of the cases in Alameda County recently, just a new person that got vaccinated, they got sick. None of these cases are in the hospital. If that's the case, nobody's ending up in the hospital. Why do we people are getting,
Thank you.
not very sick? I mean, what's the problem?
I think the issue is that the booster does a number of things. One is it reduces the chance of becoming infected and infectious, and so that clearly has a benefit to the community. That limits the chances of someone who's immunocompromised or not eligible to be vaccinated from becoming infected and having a bad outcome. So that's very, very important. There is also the issue that being boosted significantly reduces your chance of landing in the hospital or dying. And so there is significant benefit to the individual as well. And Dr. Finsterscheib.
Health and well-being of people. You're only looking for your special interests. That's what this is about. It always is. Good luck to you, Santa Clara County.
Thank you all for your time. I think
Thank
that wraps
you.
up everybody's questions right now, so appreciate it, and thank you for being here. We'll now begin in the Spanish portion of our
Great.
meeting event.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.